I've been asked to tell you just a little about this new plan for better health. Our plan is a service which will provide the best medical advice and treatment for everyone, every man, woman and child in this country.
These were the words of Conservative Health Minister Henry Willink speaking in 1944, announcing his plans for what would become the NHS. His 1944 White Paper was the blueprint for the National Health Service.
Mr. Aneurin Bevan.
But it was Aneurin Bevan, the Labour Minister for Health, who brought the NHS into existence in July 1948. Under Bevan, the reach of the state stretched further than the original Conservative plans. Care was not only to be paid for by the taxpayer, but hospitals themselves were nationalised too. Healthcare professionals became government employees. The NHS quickly became a cherished national institution. But the course was not always smooth. Prescription charges were introduced in 1952 after the cost of the service unexpectedly began to grow. The ensuing decades saw the NHS buffeted by various political winds. The Conservative years under Thatcher and Major introduced internal markets, attempting to increase efficiency. Under Blair's Labour government, these reforms were built upon, aided by significant injections of funding into the service. The new funding smoothed the path to a drive of modernisation, patient choice and public-private partnerships. Blair's devolution agenda also saw the Scotland Act and the Government of Wales Act give devolved bodies powers to legislate on a range of issues, including health, leading to greater divergence in health policy across the UK. Yet, in the backdrop of the 2008 financial crash, the budget balancing measures of David Cameron's coalition government led to smaller real terms increases in budgets than occurred under Labour, and a controversial reorganisation under the Health and Social Care Act of 2012, creating clinical commissioning groups and increasing competition in service provision. The past decade brought with it unprecedented challenges. The NHS's handling of the COVID-19 pandemic under Boris Johnson's government, to many displayed its resilience and adaptability. To others it exposed shortcomings. Frontline staff faced overwhelming pressure, yet they rose to the challenge, embodying the spirit of the service envisaged 75 years ago. Today the NHS budget has never been higher, yet waiting lists and patient care face significant strains. The cost of the service has risen by 50% in real terms when compared to 2009. As we celebrate the 75th anniversary of the NHS, the debate continues on how to sustainably fund and manage this British institution. With an ageing population, new medical innovations and a consequently ballooning budget, questions remain as to what the NHS will look like after another 75 years. Tom Harwood, GB News.